For 10 months through 4 seasons, our members waged the longest nursing strike in state history in an effort to win much-needed improvements in staffing levels. The struggle ended in January of 2022 with what we hoped and believed would be a landmark agreement with Tenet Healthcare that established safe, contractually guaranteed staffing levels that would allow us to come together with our administration and begin a new relationship. Unfortunately, those hopes were dashed as our CEO, Carolyn Jackson, embarked on an unrelenting campaign to violate that agreement. On a daily basis, the administration has wantonly violated the contract they negotiated. They have refused to meet with us to work jointly to address hundreds of grievances we have filed regarding unsafe staffing levels and unsafe patient assignments. In the face of this suffering, in the wake of this assault on our professional practice, we cannot wait for traditional labor relations process to address this crisis. That is why we are here today, to let the public know that the nurses of St. Vincent Hospital have filed a number of official complaints with the Department of Public Health, the Joint Commission, which accredits acute care hospitals, the Center for Medicare and Medicaid, and the Board of Registration in Nursing. We have taken this very unusual and unprecedented step in the hope that these state and federal agencies will fully exercise their authority to intervene on behalf of our patients and to hold Tenet accountable for providing the care our patients expect and deserve.
I'm Mary Sue Howlett, and I did review over 600 unsafe staffing forms that were submitted by the nurses at St. Vincent's Hospital since July 1st of 2023. We have over another 102 that were filed in January alone. This is the January pile. Hold on. These are the forms that have been filed from in the second half of 2023.
Oh, okay.
Thank you. Members of the press can see copies of, enlarged copies of some of the unsafe staffing forms on the wall, so you can see what the forms look like and what they contain for information. In our 22-page complaint, we cite a number of specific instances of unsafe staffing and other conditions that violate specific regulations established by the Joint Commission, the Center for Medicare and Medicaid, the Department of Public Health, and the Board of Registration in Nursing. The hospital is required by these regulators to ensure the safety of patient care. We heard just this morning that the Department of Public Health is in the building to investigate one of the Sentinel events that we reported in our complaints. The hospital repeatedly violates Massachusetts hospital licensure regulations under registered nurse coverage. There shall be a sufficient number of registered nurses on duty at all times to plan, supervise, and evaluate nursing care, as well as to give patients the nursing care that requires the judgment and specialized skills of a registered nurse. And the number of registered nurses, licensed practical nurses, and non-licensed nursing personnel assigned to each nursing unit shall be consistent with the types of nursing care needed by the patients and the capabilities of the staff. The complaints we have submitted provide documentation and reports of Tenet's failure to adhere to these standards, adding insult to the injury of working in such an unsafe environment. The nurses point to the unprofessional, abusive treatment they have received from the administration, and as a result, 27 nurses in the department have signed onto a complaint with the Board of Registration in Nursing against an administrator who has consistently defied her role and has placed patients at risk. In all my years of nursing, as a clinician, as an educator, and as an advocate, I have never witnessed such a blatant disregard for caregivers and patients alike, nor have I witnessed this level of courage and commitment to their patients that has been and continues to be exhibited by these courageous nurses. While these nurses serve as models of patient advocacy for their profession, by contract, their administration represents a shameful blight on the profession and must be held accountable for what they have done and are doing to these heroic nurses and their most vulnerable patients. Thank you.
I have been a proud St. Vincent nurse working on one of our medical surgical units for more than 24 years. I'll report on how our administration has responded to our efforts to convince them to address the conditions Marlena and Mary Sue have described. The impact of Tenet's practices and behavior over the last 2 years has been devastating. Our hospital, that once had more than 800 nurses, is now staffed with around 500, with more than 250 pending vacancies. While we nurses struggle every day to keep our patients safe, management refuses to engage in any meaningful effort to recruit and retain needed nursing staff. Nurses who are recruited to this facility end up leaving, many before they finish their orientation. Newly graduated nurses are also leaving at increased rates as they are finding that working in these conditions is unsustainable. While tenants spent more than $5 million a week during our strike to recruit more than 200 travel nurses to break the strike and avoid safer staffing levels, now the administration is refusing to hire adequate travel nurses to supplement the lack of staff to ensure safe patient care.
In my 4 decades working at the hospital bedside, including for a time at tenant-owned Metro West Medical Center, and having been an advocate for nurses in the Commonwealth struggling to provide care under oppressive conditions, I can honestly say that what these nurses are facing from this administration and this corporation is unparalleled in its depravity and its callous disregard for nurses and the patients for whom they care. It is rare for our members to take this step they have taken in issuing these complaints, but as they have made clear, they had no other choice. Their patients are suffering and they are being harmed for want of the care these nurses so desperately want to provide. While this is the worst case, it's not the only case, and it simply serves as the best example of how corporate greed and administrative malpractice, how understaffing by design to boost profit margins is destroying our hospital systems from Cape Cod to the Berkshires, is creating a shortage of nurses unwilling to work under these conditions, and leaving the most vulnerable in our state at risk for serious harm. We can only hope that the regulatory agencies charged with holding healthcare providers accountable for their behavior and their practices do what is needed and heed the St. Vincent's nurses' call for help to save their patients before it's too late.